An electrocardiogram, ECG, is a test that records the electrical activity of the heart. Here are the steps to read an ECG. 1. Check the patient's details. Ensure that the patient's name, date of birth, and other relevant information are correct on the ECG report. 2. Check the ECG paper. Ensure that the ECG paper is standardized and the calibration is correct. 3. Check the ECG leads. There are 12 leads in a standard ECG. Ensure that all the leads are properly attached to the patient's skin and the electrode gel is applied correctly. 4. Check the heart rate. The heart rate can be calculated by counting the number of small squares between two R waves and dividing it by 1500. This will give the heart rate in beats per minute, BPM. 5. Check the rhythm. The rhythm can be determined by looking at the intervals between the R waves. The R to R intervals should be regular. 6. Check the axis. The axis is the direction of the electrical activity of the heart. A normal axis is between -30 and +90 degrees. 7. Check the P wave. The P wave represents the electrical activity of the atria. The P wave should be upright and smooth. 8. Check the QRS complex. The QRS complex represents the electrical activity of the ventricles. The QRS complex should be narrow and not exceed 120 milliseconds. 9. Check the ST segment. The ST segment represents the time between ventricular depolarization and repolarization. The ST segment should be isoelectric. 10. Check the T wave. The T wave represents the ventricular repolarization. The T wave should be upright and smooth. 11. Interpret the results. Once you have checked all the elements of the ECG, you can interpret the results. A normal ECG will show a regular rhythm, normal heart rate, and normal intervals. Interpretation of the ECG requires a thorough understanding of the normal and abnormal ECG patterns. If you are not trained to interpret ECGs, then it's best to consult a qualified healthcare professional.